Hey Nadia,
Hello.
how you doing?
Good. How are you?
I'm good. You're in your new apartment for the summer. How is it?
It's good. I've been here 2 days. My new bed is a full, so I'm no longer in. It's not my bed, but the bed I'm sleeping in is a full, and I just have missed being able to have room and a
Mm,
comfy mattress. So
mhm.
it's really
Awesome.
nice.
It's not because you're accepting guests into that bed, are you?
No, it's for me.
I'm
Actually,
just
it's also
kidding.
not my bed.
I'm kidding. I'm not going to shame you. I'm just use that moment to
She's 1 minute into the podcast and she's already.
um speaking of interactions with people, we talked a little bit about your interactions at work. And sometimes people have compliments to give you because you're working at that front desk. And sometimes people think they have compliments that they're giving you, but I don't know. I want to know how you feel about it when they ask you things like, oh, what are you? Or like, what do
Yeah.
they ask you? What are you?
What did I tell you? Because it happened to me recently. It doesn't happen very much. I think it just happened 2 times in either the same, I think it was the same day. And I think it was like a what are you? Sometimes people ask, like, what ethnicity are you? And I say I'm Filipino. And then they go, oh, like I could have guessed. And the
Mm,
time that I told you about that happened recently, um, one of the people was like, "Oh my god, I totally was gonna guess that," and the other one, I think I don't know if he was, I don't know where he's from, but he was like, when people say that type of thing of like, "Oh, like I knew you were Asian, but like I didn't know," like they know, they just automatically assume I'm not like Chinese, Japanese, or whatever.
hmm
And then he's like, "Oh, so I knew you were Asian, but like I didn't know which one." I was like, "Okay."
Do you feel offended or
Thanks.
do you feel like objectified or do you feel just like
No, I mean, those people were
anything?
really nice. Those
Yeah.
people were nice. And like, it's a little bit awkward, but I can't really do anything about it because I'm the one at work. Like, I'm
Right.
working.
No, I'm not
So,
saying you should do something about it. I'm just
but I don't
wondering
know.
how it makes you feel.
Did I
Yeah,
talk on the podcast about when it happened at work? I mean, not at work, at the grocery store. Did I? Maybe.
I'm not sure.
It
Do they
happened to
ask
me. Wait.
you where are you from?
Yeah. But I guess when I was working at the grocery store last year, people are less nice. Not
Oh,
like less
really?
nice, but more direct. Like
Like what?
like I'm just a cat. Like I was just a cashier, so it was like I don't know. Actually, now I can't even remember the situation, but I felt negatively towards it afterwards.
Mm,
Not like they had like offended me, but it was weird. And then when I was at work, I mean, it's still a little weird, but like it was fine. Like I didn't
yeah.
feel like put off by it or anything
Has
like
anybody
that.
ever asked you? I guess it's not that weird for people to ask you, where are you from? Because you're not
Mm.
from Boston. So then it feels normal. When
But I
people ask
know
me
they're
in
not
California,
asking.
I'm sorry, what?
I know they're not asking like what state am I from. That never happens.
Yeah. So do people ask you that? Where are you from?
What do you mean?
At
Like, yeah.
school
Oh,
all
at
the time.
school? I guess a bit like at specific conversations. Like, if I'm like, oh my god, I've never heard of that. Like, people call things differently here, just like
Mm,
common terms. Or, like, there's, maybe this is on the West Coast, but there's this like Costco like store called BJ's here, which the BJ's at home is a restaurant, not a Costco. So people at work were talking about it. I was like, and they were like, oh, like you can get a new membership there for really cheap. And I was like, a membership to BJ's? I can get free Pazookies? That's not what they meant.
So you
So
really
Costco.
are not from Boston, but I do feel weird when I'm in California, which is where I'm from, and people ask me, "Where are you from?" I'm like,
Like
"I'm
here?
from right here."
Yeah.
Um, yeah.
But
And
yeah,
what are you is kind of like a weird thing. Just the phrasing is weird.
I think depending on how it comes out of the person's mouth, I say I'm Filipino or I say my grandparents are from the Philippines.
Yeah.
I think it's a where, what are you versus a where are you from?
Yeah.
I guess I would
My
say
canned response
California.
is I was born in New Jersey. I grew up in California. My parents are from the Philippines.
Why do you even mention New Jersey? You never even like
I don't know. I feel like it's more complete.
makes you feel special.
No, it's just like, I feel like if I leave that out, it's not the total truth. I don't know.
Yeah. Um, but yeah, I guess.
Okay. Well, I was in a conversation this weekend,
Mm-hmm.
um, full of it was a meeting with a bunch of other professionals. And they were almost all, of European descent.
Mm-hmm.
And, they were almost all blonde.
Is
And
that your
they were
nice
asked,
way of saying
they're
white?
white. I don't know. Yeah, they were all white. And so, I mean, but not just like white. They were blonde, you know?
Okay.
And they were asking me how my weekend was. And I said it was great because I was snowboarding at Mammoth and I found that there were like a lot more people of color on the slopes at
Oh,
Mammoth.
really?
Yeah, it just
That's
felt
so
more
interesting.
diverse. And I was like, I really, that it really means a lot to me to see a lot of people of color on the mountain. And then all of a sudden I felt like a little bit like, did I make them feel weird that I was pointing out to them that I'm a minority and they are not? I don't know. Or like, I don't know. I thought that maybe I don't know, made people feel uncomfortable. But then I just settled in with, it's okay
I
to make
mean,
people
like,
feel uncomfortable about that,
yeah, I think it's funny sometimes.
to make people feel
Because,
uncomfortable.
yeah, well, because I feel like most of the time I'm in situations, and I grew up, I don't know, I am a minority, but I didn't always feel like it because there were a lot of Asian people um, at, and half Asian people, I guess, at my high school and here too. I feel like this is a pretty diverse school. So I don't always feel like the minority, but like I like to make funny jokes sometimes, and then people don't know what to say because I'm like, I'm joking, but they don't want to say the wrong thing.
Like what? Do you have an example that you feel comfortable sharing on a podcast?
I just say sometimes if I like being fake offended, and I ask them if it's because I'm brown, and then they're like, I'm like, people get uncomfortable. Me and Elena think it's funny. Elena's my roommate. Um, but sometimes it's extremely unnecessary and I don't actually mean it, but I think it's funny to bring it up sometimes. Because I know it's never the answer. That's why I think it's funny.
Mm.
Which I
It's good
mean,
to make people like think about it, for a second.
think
Like,
about it and
oh,
then be
did
like,
I just say something offensive?
yeah, but I guess that's kind of mean of me because super unnecessary. And I'm usually saying it in a sense of, in a time where it's not valid. It's not the reason. But
Yeah. I mean, but I mean, I know that you've experienced some blatant um, racism or being called out because you're Asian. Like we were
what do you
together
mean?
when
Oh,
like
like
those,
in.
yeah, when those two boys
Mm,
like move their corners of their eyes up to kind of make
I
fun of
know, but
us.
I
Like,
always feel like, I mean, in those situations, I don't know. I don't know why. I like I when you were saying that, I was like, I've never experienced blatant racism. I feel like I only experienced microaggressions. But maybe
Mm.
that's like because I don't realize.
Well, yeah. I mean, I guess it's here we are going into definitions now of like where's the line between a microaggression and racism.
Yeah,
Microaggression
yeah,
is
yeah,
part of
yeah.
racism is like a systemic um situation, but you know, that's beyond probably the scope of our cute little conversation here, but yeah, I mean, but actually it's not, because you know, experiencing microaggressions on a daily basis, experiencing prejudice, racism, feeling like you're being let down by the system because of who you are and what you look like, that does contribute to stress, like a daily stress. And that daily stress does contribute in a negative way to your health. So,
Yeah. Yeah.
yeah.
I don't like, I know what a microaggression is, but I only really realize it until a little bit after, or if I'm like talking about it with somebody else, or somebody else is sharing their experience, and I'm like, wait, I think I've experienced that before. This
Mm-hmm.
doesn't register in the moment. I think I grew up not knowing what it is.
Or
So
you
just
maybe you grew up
assuming that,
not
like,
feeling like you should be offended by certain things that
right,
people say.
right.
Mm-hmm.
Or that I could be like in on the joke, you know?
Yeah.
But
Yeah. I
I
mean, I
honestly
guess that's
can't even
one
think of it
defense
right now.
mechanism, right? Like, is
Yeah.
to like, it's okay. I'm cool with it. We can just be in on the joke. This is, haha, that's
Yeah.
funny.
Yeah. Um, I'm trying to think. I feel like feeling like I had an experience recently, but I can't remember. Um, hmm,
No. I mean,
yeah.
sometimes there's just a situation where you feel like people are going to assume that you're going to take the lower choice, the lesser choice, the other seat, the, I don't know, you're going to just basically like in general take the quote back seat, you know,
Yeah.
because this isn't your world or whatever, or like other
Hmm.
people are meant to be in charge, or people are meant to have the better whatever
Right.
slice of pie.
Yeah. I don't know. I feel like those are things I don't realize in the moment, just like thinking like back on it. Recently, I don't know how to find this emotion or like know why it's happening, but I take the public transportation to work, and um I'm not on it for very long, but when I am on it, I like usually am like not really on my phone. I guess it depends, but I'm like looking at the other people that are on the train or on the bus, and a lot of people of color are on the train and buses, and like obviously it's not everyone. Everyone takes like public transportation, but for some reason I feel like this sense of like I fit in with the crowd because I'm a person of color, and like looking at someone that's not, it's like they're the minority in that situation, which is definitely a weird feeling because I'm also in that sense, like I'm like going to work. I have like the shoes that I bought for like because I wanted to online, and like the bag that I didn't pay for, but the Longchamp bag that is like expensive, and like I don't know, it's just all these other things that make me like out of that, not out of place, but like um I don't know if they stand out to everyone, but they stand out to me if I'm observing someone. Like I'm gonna look at like what shoes they're wearing and what bag they have, and then probably the clothes they have on. And so I don't know. It's a weird. Oh, I've had this like um this internal discussion with myself recently, but I don't really know how to explain it or say why it's happening. But I'm just like, or maybe I'm just trying to find a reason, not a reason. I don't know.
I don't know. Part of me feels
Make a sense of community.
Yeah. Part of me feels like actually quite relieved that you feel a sense of camaraderie and community with people of color, because I feel like socially a lot of your time is not with brown people, and your dad and I always
Yeah.
talk about like, I wish you would hang out with some Filipinos every once in a while. We feel like we've done you wrong. We've like maybe raised you to feel less comfortable with Filipinos. And then we're like, what did we do?
I don't
Especially
know if
compared
it's
to
the
your
way,
cousins who
like,
hang out with so many Filipinos, they're like in a Filipino
yeah.
immersion type situation. And all of their friends
Um,
are like, totally Filipino American culture with like
hmm.
DJs at birthday parties and lumpia at birthday parties,
I mean, I still had that.
a little bit.
I don't know. Like, I guess it's the way I was raised, but not that I like think that you should have raised me differently. I don't
Yeah,
know.
no. I just
But
I also observe it, but it is a relief for me to feel to know that you feel a sense of like kinship with
maybe
people of
not
color.
like that going that far, but like, because I don't know, it's a bunch of random people on a train. But I don't know. I guess it's just like me finding my place in the city because I'm usually on campus. Like I've been talking to a lot of people that you've shared my phone number with, um, about to like speak with them about Northeastern, and yeah, I just been talking a lot about how I feel like I've lived here for over a year now, or not over a year, yeah, over a year, and I barely leave the city. So I'm like, I really like that co-op has like let me kind of explore, but not really because I don't go past South Boston. Um, but yeah,
So
I'm
you're
not
out of
just
your
on
campus
campus.
bubble.
Yeah, mm, which is
Yeah. And now
nice.
you're even more out of the campus bubble because you're living off of campus.
Yeah, which is also kind of cool because I think a lot of people that are here right now, well, school, like the summer one semester starts next week, next Monday. But right now, like everyone that's out, like I was like walking home from the tea, like a bunch of people that like just came back from work. It's kind of funny.
You feel like an adult.
No, but like it's just I don't know because I guess it was just like two of my roommates didn't do co-op at the same time. And this is like the cycle as a second year. This is a cycle where less people do it. So like in general, my friends as a whole, not there's not that many doing co-op right now. So like I don't know, I'm like, oh, other people are doing it too.
Mm-hmm. I spoke briefly with the adult that you hung out with this weekend who
Mm-hmm.
was touring her nephew. And her
Yeah.
impression of you was that you're all grown up now, that it was neat to hang out with you like as a mature person.
Yeah. I really just, I've been talking on the phone with adults so much that like, I don't know. Not that it wasn't easy before, but like I'm more comfortable doing it.
That's awesome. That's good.
I know. But I've been answering so many phone calls. It's making me want to cry.
I guess
But
that makes
yeah.
you know that you don't want to be a front desk person for the rest of your life.
Yeah. I wouldn't be able to handle it emotionally. The patients would also get the short end of the stick at that point.
Mm-hmm. Some people are so good at the front desk. Okay, let's like veer to another conversation. I made a phone call to speak to set an appointment up to set up an appointment for Finn, the dog,
Mm.
at this highly recommended like holistic vet
Oh
clinic.
my god. Oh my god.
I know because I think he has a gut microbiome
Oh
issue.
my god, it's a dog. He
Well,
eats grass.
Anyway, that's not the point of my story. The point of my
Okay.
story is I talked to the front desk person,
They were
and
rude.
yeah, like I don't think she knows it. I think she thinks of herself as being efficient,
What
but
did she say?
she'd ask me a question, something like, what do you want to bring your dog in for? And of course I have a whole answer. Well,
Hmm.
my dog has another vet and he's been going through chronic ear infections. He's had a lot of antibiotics,
Hmm.
and he also has itching and sometimes soft stool. And so I want to
Maybe he
bring him
does
in
have
for
a biome problem.
I want to bring him in for an entire visit to take a look at, his whole health. That's my entire answer. But she cut me off before I could get there because it was like too long. Like I was like, so he has chronic ear infections, and she cuts me off. She's like, are you a new client? Are you a new patient, or is this a return? I'm like, oh, we're new. And she's like, okay, new patient evaluation. And so like
That just shows that like I could sometimes that happens because there's like for me there's like a system to the way that appointments are booked. So
mhm.
if you get on the phone and the patient just starts talking, then like you're like, wait, I'm gonna have to have them repeat again. But it's easier to have them just talk versus like interrupt them during it. Because recently, I feel like today, I think I'm just answering so many phones, but like interrupt people and like, okay, what's your birthday? Before they even finish, I'm like, wait, like, I feel like if I was on the other side of the phone, then I would be kind of annoyed. And I think that when you're at the front desk for so long, that it like you only want to do it your way, and um, you just want to get off the phone.
Totally. I mean, I get it. I get
So she
that's
was
why
like,
she was cutting me off, but
yeah,
I think maybe she should take notes and then just kind of let me go and just speak in a way that makes me feel like she actually cares about the reason why I'm calling in. You know what I
yeah,
mean? Like
yeah,
otherwise you end up feeling like, okay, sorry, I don't know.
yeah. No, yeah, yeah. I think that happens to me when I'm on the phone with the doctor's office. I'm always apologizing, stuff, but it's my job. So, like, it's on the phone. Like, that's your job is to, like, make sure that the patient gets what they want.
Hmm.
So when
And I
you're
guess it's another
rude,
question. Like, what is healthcare? Like, is it meant to be like a customer service? I think so. Like, you're there to serve the patient in front of you. You're
it
not there
is
to
like,
just get them through a system efficiently?
yeah, when I was first starting, I had a patient or someone on the phone that was like, I need to speak to a customer service representative because they were unhappy with what like someone else that they had spoken to. And I asked my supervisor, and she's like, "You're the customer service representative. Like, if they want that, like, you're the person that they talk to." I'm like, oh, "Okay, well, that probably makes sense." But
Yeah. Yeah.
yeah,
And just that, like, we're talking earlier about, what contributes to your health and like, and stress, like feeling the repercussions of systemic racism, feeling prejudice, feeling, knowing on a daily basis that you're a minority, all of that can contribute to stress, and that stress can contribute to poor health outcomes.
yeah,
But another way that we can take care of people's health is the way that we interact with them in the healthcare system,
mm-hmm.
helping people feel like they're being heard, helping people feel like you're there to help them, not just check off the boxes and push them
Yeah,
through and cover your butt as you know, deal with them.
right.
Like, I don't think that, I mean, I know that that contributes to poor health
Mm-hmm.
outcomes, a poor experience, and even just a poor experience will have somebody not want to reach out to healthcare again?
Yeah, yeah, very, very true. I think that's like the really good thing about the health center is that like it's for the specific community, and there's a big Albanian population. Like I've talked about, they have the Albanian in-person interpreters and the Spanish in-person interpreters. So that community, they know that if they go here, like they'll be able to speak to someone that understands them and can like help advocate for them, because like the interpreters at the health center like speak directly with the providers, will message the providers for the patient. Basically, does what I do, goes into the room with them if they're comfortable with that. Like, I don't know, if I knew, if I spoke another language and I knew, like, even if I spoke, well, I do speak English. If I was in a Spanish speaking country and I went to a doctor's office and there was an in person interpreter that spoke English, if I didn't understand Spanish, then, you know, I'd feel more comfortable just to make sure, like, there's no miscommunication.
You know,
Right?
I'm about to laugh, right? I'm
Why?
remembering when we reached out we went to the doctors in Colombia,
For my
and
scabies?
and you, yeah, and you were with me, so you and I together could like interpret in Spanish or whatever. And you
Yeah.
understood Spanish, but on top of that, you had me. But your dad was by himself,
Yeah.
and I'm sure he's not going to like that I outed that he had scabies. But yeah,
I
so
talk
he
about it
had
sometimes. I think it's funny.
he got scabies from probably from a rental we were in Costa Rica.
Mm-hmm.
And we were in Colombia and he was by himself, and
In the
he
appointment, he
heard
was by
scabies in
himself.
Spanish and he thought that he was diagnosed with scoliosis, which clearly
It's not
doesn't
the
make
same
any sense.
thing.
Yeah. Especially
Yeah.
with his symptoms, like that, he had bumps and itchiness and he was feeling a little bit ill. That does not happen with scoliosis. So
Yeah.
it makes a big difference.
Yeah.
And, when you can speak, when you have an interpreter, but also when you can speak directly with the patient in their
Right.
language. I've had people, as a physical therapist, had people tell me, I'm so glad that I can tell you about my pain directly,
Because they
and
speak
I would just,
Spanish.
mm-hmm. And I'm not completely fluent, but that really meant a lot to them that
Yeah.
they
And
could speak
like,
to me directly.
even at the front desk, like, sometimes I'll have the interpreter come, but if they say that, like, they'll ask me if I speak Spanish, and I think sometimes they assume I speak Spanish, or like they think like they assume, like, I don't know, they make an assumption that like maybe she knows, and I do, and I'll say like I know a little bit, and then like it's like almost like a relief because I don't have to like try to, But if I don't understand them, then I have to call the interpreter. But there are like other medical assistants that have worked there for a while that like either speak Spanish or Albanian, and they don't always tell the patients at the front desk that they do, just because like they'll like be stopped from doing the rest of their job, because now that patient knows like if they come and ask for them, they'll be able to get help like immediately, whereas like you would usually have to be with an interpreter. But I don't know, it definitely, like, I feel like it's a relief, and leads to less miscommunication and all that.
I think everybody needs to spend some time in another country and feel what it feels like to not have that country's language as your primary language. Like
Right.
it's so humbling and hopefully gives you more empathy for people that are in
Mm-hmm.
this country that don't speak English.
Yeah. Yeah.
I mean, you experienced that in Greece, having to access healthcare, even though the physician spoke Greek, like just being an outsider in Greece
Yeah.
made it harder.
Yeah. It's like almost as if like you don't want to say everything and you kind of just want to give up because it's like not, I don't know. It's very disheartening, and then you don't get the care that you could probably get, but don't want to explain. I don't know.
Yeah.
Not that you don't want to, but like
It's too
it's
much.
too
It's like,
hard.
yeah, so much effort. And
Yeah.
your sister is going to be going to the Czech Republic for her first semester. And
Mm-hmm.
it's so important for her to be able to say, I'm allergic to peanuts in Czech. And I was trying to get her to
See,
say it
I don't know how
yesterday,
to
and she
say it
was
in
refusing.
I don't know how to say it in Greek.
Well, you probably should have learned.
Maybe. But I don't know. I didn't, well, to be honest, I didn't really eat out like in Greece too much.
Mm-hmm. Well,
But yeah.
anyway, and I hope that next time you have somebody that doesn't speak English at your clinic, that, I don't know, you think a little bit about how it was hard for
Yeah.
you. I
Honestly,
mean, even
like,
just a smile goes a long way. Like a
yeah.
smile, like, I'm really here to help you. I'm sorry that I don't understand your language, but I'm going to do the best I can with you.
Yeah. Um, Sometimes my coworkers that speak Spanish, if they're near me, they're like, "Oh, that was good." I was like, "No, it wasn't." Like, I just had to think too much about what I'm saying. But hopefully, my Spanish will get better. Or like, I don't know. I'm too
I,
used to speaking in a class when I can like look it up or like think beforehand.
yeah.
So
Yeah. And it's also like when you have a coworker right next to you that speaks the language, all of a sudden you feel like self-conscious because you're like, I know this person can do a better
yeah,
job at me than at interpreting this.
yeah. And I
Um,
don't know like all the medical terminology, so that really doesn't help too. Sometimes I do have to ask because like I don't know body parts,
yeah. But you
pain.
know, it's interesting sometimes how language is like sometimes has a better job of explaining what's going on. Um, like certain
Yeah,
languages have a better
yeah,
job, like do a better job sometimes of explaining what's going on or help you think about something in a different way.
mm,
Like I had a patient one time that said, like, if you interpret it, if you translate it directly from Spanish, he said, when you touch me here, it answers over here.
mm-hmm.
Like that's, and I was like, oh, that's so interesting. Like, as
Yeah,
opposed to saying, I have radiating pain or whatever. It's like, when you touch me here, it answers over here,
yeah.
like on my pinky, which is
Oh,
interesting.
interesting.
Yeah. And it made me think about like the symptom in a different way, which was kind of cool.
Yeah, cool.
Anyway. All right. Well, hope you have a good rest of your night and maybe you
You
think about
too.
this tomorrow at work.
And I will work on my Spanish.
Good idea. All right. Bye.
Bye.